Okay, so this is a patient that, if we're looking at the anterior x-ray, we're looking at a compressed disc at the L5. He has slight deviation to the left, okay, on the lumbar, and then a deviation to the right in the thoracic. If we're looking at the cervical, there's not a lot of deviation, just slight. You can see from the side portion, it's not a clear picture, but you can see it is the curve. There's a loss of curve there, and there's probably a grade 2 degeneration happening. So I've been correcting him for, this is his second week now. He's already starting to feel much better. So you see there's also some degenerations happening in the upper thoracic, and you see some degenerations happening in the lumbar. Now you see this is not a degenerative disease. It's basically just the body restructuring to protect the nervous system. And on the bending films, you can see that there is something not bending right with lower 5. So basically right now we just have him on abdominal suspension. Okay, so we got him on abdominal suspension. So right now we can see that we have an increase in tone on the left side. So which means that the spine is going this way to the left and then deviating to the right a little bit. Exactly how. So we're never going to, I'm going to use my converted jigsaw. We're never going to vibrate on the convex side. It's always the concave side that we're going to vibrate. Doing that until I can feel a change in tone in those muscles. So now what we're going to do is we're going to distract. Okay, and I'm always pressing on the convex side, distracting, opening up that lower spine, and hydrating those discs, and at the same time it's powerful corrections on the spine. So once again, pressing mostly on the convex side. Holding it. I want to go from this side. Now we're going to set the drop, flex them. So I'm flexing towards into the convex side and dropping it. That's going to cause an inflammatory response at those disc levels, and that's how the body heals itself. And every drop is also going to change proprioceptions on how the brain views the body, and that's the key on how to correct any spine deformities. Okay. One more time. Just want to get right to. Excellent. One more. Good. Go this way. We're going to drop a couple of times. We'll open up. What's wrong with this right here? we're going to do an angio release now. So we're going to hold them on this side. Good, excellent. Right here. Awesome. Good. Okay, move up. Ahora. Un poco más allá. Okay, so now we're going to just gently drop his cervical to cause the inflammation in the cervical area. That's too gentle. It's going to increase the tone. That's one. Good, excellent. So this way up. Good. So this is a C1 correction. I'll go for the other side. C1 correction, I'm going to do a little bit different this time. Good.
Simple. Have to go open the door.
Okay, good. Please open the door.
Oh.
Good. One more time at the lower lumbar area, driving it down. Good. So now we're going to get the sacrum. So by getting the sacrum, you want to extend it. Okay. Driving it down. Grabbing it, so but you're not going to let the patient fall. Good. Awesome. Good. So here we're just going to take care of this, the thoracic area. Just drop it a couple of times. Good. Beautiful. So here on this side, we're going to get the pelvis. The pelvis, we're going to drop it down. Good. Okay, on your back. Okay. So with the cervical right now, you're going to just palpate lower, middle, upper. Just get it too. So when we're doing this, we're helping that natural curve of the cervical, because it's called the curve of life. C3, C4, C5 keeps you alive, and this is where the major cause of this problem is in the cervical area. Good. So now we're going to go down and check the sagittal suture, because this is such an important area where the nervous system communicates with the body, and just putting pressure on that area. Good. Look at it straight, just a little bit off. On the cervical, we're just going to adjust him by gently on the upper left side. Just going to increase. Good. On this side. Good. Okay, now we're going to suspension and traction. This is an excellent move to get. It's a powerful move. Traction slowly, and then just a gentle thrust, just like that. Here we'll feel it all the way down the spine. Okay, move down. Okay, good. So now this is how we're going to adjust the both the lower and the thoracic area. So we can see that because he is going to the left, so my first move is going to be that way, and then the upper this way, and then we're going to finish off that way again. Okay, so you see, this is the spine right here, so you're going to just slightly to the right. Good. Again. Good, and then up. Again. Good. Down. This. Good. You want to grab on. Now breathe out. Breathe out. Breathe out. That's it. That's a major adjustment in the upper thoracic area right there. Nice. I'm just going to check his toe. We're going to finish off by Good. Good. Great. That's it. He's all done.